Around 6,000 men are diagnosed with prostate cancer every year in Switzerland. One method used to detect prostate cancer at an early stage is PSA testing. PSA stands for prostate-specific antigen, a protein that is only produced by cells in the prostate gland and can be measured in the blood. A raised PSA level in the blood may indicate that there is a problem with the prostate gland. However, PSA testing can also cause false alarms and unnecessary treatment. As a result, opinions are sharply divided as to whether or not this test should be carried out. This is reason enough for us to take an in-depth look at this subject. Helsana is committed to health and actively encourages personal responsibility and health literacy. We take a close look at complex health issues and reveal the facts. The Harding Centre for Risk Literacy has summarised the benefits and risks of PSA testing for the early detection of prostate cancer based on scientific studies. In 5 long-term studies, men aged 50 years or older either participated or did not participate in regular PSA testing. After around 16 years, the participants and non-participants were compared. Across both groups, a total of 322 in 1,000 men died. Of these, 12 in 1,000 men who did not have early detection and 10 in 1,000 men who did have early detection died of prostate cancer. 155 in 1,000 men who took part in PSA testing received an abnormal test result that subsequently proved to be a false alarm. However, finding this out usually requires a biopsy, which involves removing tissue from the prostate. In addition, 51 in 1,000 test participants were diagnosed and treated at least once for non-progressive prostate cancer that would never have caused any problems during their lifetime. This is referred to as over-treatment. As unnecessary treatment for non-progressive prostate cancer can also cause impotence and incontinence, the test exposed these men to health risks. In summary, this means that through early detection, 2 in 1,000 men were saved from dying from prostate cancer, although it could not be shown that fewer men died overall during the period, regardless of the cause of death. Of all of the men who took part in early detection, some who did not have prostate cancer were alerted for no reason, and some were diagnosed with non-progressive cancer and treated unnecessarily. In light of these facts, it is ultimately up to each individual to decide whether or not to undergo PSA testing. We hope you now have a clearer overview of this complex issue.